I mean, I think a lot of people are asking whether there is a way to use telehealth to maintain access for people who are in states with bans or expand access. And, so far that's, I think, going to be very challenging. But I mean, certainly, in light of the restrictions, as we're seeing more patients traveling, for example, to California, to other states that have more supportive laws, there is an important role for telemedicine in those states where telemedicine medication abortion has really become a standard of care. We have a great deal of evidence about the safety and effectiveness of this model. And telemedicine can be used in those states to potentially move some patients out of the clinic, out of facilities where abortions are being performed so that there's more capacity to serve patients who are traveling. It would be legally very difficult to provide telemedicine across state lines to patients in bans. These states not only ban abortion, but they also most of them have bans against the use of telemedicine for providing medication abortion. It would be hard to maintain a license in those states. Massachusetts did just recently pass a law that does seem to allow some protections for the provision of telehealth across state lines. I think that remains to be seen how it will be implemented.
Telehealth certainly has a potential to help free up space in clinics in states where telehealth is allowed. But for example, in Texas, telehealth has always been banned specifically for medication abortion, even when telehealth provisions were being expanded for other aspects of COVID healthcare. So opening up space for clinics in states with abortion provision is, one of the many benefits of telehealth. But we also have yet to see telehealth really address disparities in healthcare across the board. So we don't have good evidence that telehealth expands care specifically for Black and Indigenous communities, people who are immigrants, undocumented. And so those are the most structurally oppressed groups of people that we care for. And it is not clear that these tools are actually the resource that those folks need.
Besides even just medication abortion, pre-op and post-op services for patients who need later term abortions. I think telehealth avenue is a really nice, in an ideal world, way to get maybe save a patient coming across state lines some time, not taking as many days off work, to kind of prepare them for the procedure and kind of expedite the process. The legality of it is still a little murky. I know for myself, this is how I do expedite my own patients in my practice into those later term abortion cares and try to get them care as quickly as possible, because aside from the topic itself, it's extremely time sensitive. So I think the telehealth can play a huge role, and there's a lot of room for benefit there, but it's yet to be tapped into, and hopefully it'll be something that'll kind of transform the care that we're able to provide.